Take a breath in and blow it out. So we're going to look at Chris today. Chris is a business owner and actor. It's lower back, right? Tell us about it.
Yes. Each side of my lower back pain is kind of vacillating between the two for the last 2 weeks. And especially when I stand up, it feels really stiff.
Okay, so sometimes you get on the left side, sometimes you get on the right.
Yes.
All right, cool. So lie down. Let's get started. Put your nose, face down. Put your nose right in here. And scoot up a little bit so you're higher on the table. Perfect. So the first thing I'm going to do is start to check Chris. And I like to check the leg alignment. And I'm going to put these funny little shoes on him. And these are shoes that are made by the company that makes the instrument. It's an activator technique. And but you'll see here, I'm going to have you move the camera a little closer so we can see what we're doing. And I'm going to bend the legs once or twice. Bring your arms alongside your body. Good. And that just kind of clears this posture. But could you see how the right leg is pulling short? And I'm looking right on this edge here. And when I bring it up to this position, they even out. And the Velcro's coming off. There we go. So the first thing I'm going to do is just see if the knees are involved. Do your knees ever hurt, Chris?
No, but sometimes the hip.
That's the first thing I'm going to work on is the hip. So there's a setting for the hip. It's a 3-point move. I'm going to hit the sits bone. I'm going to hit a ligament right next to it. I'm going to come straight down into the fossa of the ilium or the glute. And let's look at it now. Even. So we're not done, but that's a good start. Next thing I'm going to do, Chris, is take this leg as a long piece, so don't bend it, and lift this as high as you can. Good. And then do the other side. So put that one down. It'd be funny if I had you lift both sides at the same time. Here, put this down. Yeah. Did one side feel different than the other? Was it achy? Was it tough to do? You could try it again.
I think the left side, it wasn't paying that much attention, but I think
left side was a little harder?
Left side felt more discomfort.
All right. So that didn't throw it off just doing that. So I'm going to push the legs all the way up. When I push all the way up, it would be normal to feel tight in the quads, but do you feel any tenderness here when I push this up?
No.
Okay, good. So let's keep going. Squeeze your knees together. Good, and relax. Put your right wrist on your lower back. Just drop it up there. Perfect. The legs stayed even. Switch sides. I'm just raising the table a little bit. Now both arms on the lower back and both arms back down. And then take this arm to the top of the table. So we're doing different isolation tests. I checked the lumbars. Now I'm up here in the thoracic area, which is about from here to here. Switch arms. And now do both arms to the top of the table. And the legs are staying even. I'm not finding really anything where there's a subluxation or an irritated nerve. Bring both arms back down. Turn your face to the right. And that just made the leg. Go back to center, and you can see what I'm looking at in the feet. So as you bring the camera a little closer, turn your face to the right, and the leg goes short. Turn it back to center, and the leg evens. So there's something going on the right. We're going to do a few things. Turn your face to the right, and before we get up to the neck, we're going to check his shoulder blade, specifically T6, really close to the shoulder blade, and we're going to adjust that in 2 places, on the vertebra and also the rib next to it. So now turn your face to the left again. Let's see if that worked. Looking down at the feet are balanced. Turn your face to the right now. Lift your right shoulder off the table. No, just the right one like this. Yeah, the other right. And then drop that down. And again, that's showing up. That made the leg go short. So we're going to come up to T4 this time. Now this time, turn your face to the right and squeeze your elbow into my hand, okay? Good, and then let that relax. You can put your head back to center. And that made the leg go short. So we're going to check the shoulder blade next. And I know he has his lower back, but we're going to do more of that in a second. So he has a medially rotated shoulder blade, and I'm going to adjust it from medial to lateral. I'm going to adjust the humerus superior. I'm going to adjust the radius here. Chris, look this way. You can have a tender spot right here on the head of the radius. Watch this. Do you feel that?
Yeah, yes.
Yeah. Sorry about that. And then bring this arm back down. And we're going to also adjust the lunate bone. Squeeze this elbow into the side of the body one more time. Let it relax. And the legs should be even again, and they are. Now, shrug your shoulders. Relax. Look up straight away with your face. Back down. Tuck your chin towards your chest. Relax. Push your face into the table and relax. Good. Turn your face left, right. Let me know if it's stuck anyway or any place where it still feels tight.
No, it feels pretty good.
Good. So let me dig into the lower back a little bit. Do you feel that one there?
Yeah.
Yeah. So I'm going to just do a little bit in there. What I'm feeling here is the QL. The QL is super tight on him. I'm just going to adjust into some of the trigger points I'm feeling. You feel that one? Yeah. All right. And now I'm going to use the hypervolt for a second to dig in and get a little massage on that. How's that feel? Too much?
No, feels good. Almost like a giant tickling machine.
He said it's like a giant tickling machine. Let's even feel it up here. Does that make your face tickle?
Good. Now I feel most of the back.
Yeah.
Feels good though.
A little bit in the glutes.
Yeah. That's
Tender spot right there.
I feel in my feet. Good.
So the next thing we're going to do is I'm going to have you turn to your back. I'll take these shoes off. You don't get to keep them.
Oh.
And lie on your back, please. And scoot all the way to the top of the table.
All the way to the top.
All the way. Good job.
All the way. Without falling off.
So let's do a little adjustment on the neck, okay? Good. Take a breath in and blow it out. Do you feel that one?
Yeah. Got a good pop.
Good. How about this one? Little ones, but they're good. Sometimes they're just little, sometimes they're bigger. Now I'm going to have you lie on your side facing me this way. I'll put a pillow under your head. I'm going to try to open up that lumbar because the lumbars feel a little compressed and I want to get them to release a little bit. So scoot towards the edge, towards me just a little bit. Let me have this arm to get it out from under you and let the shoulders roll back. There they go. That was a good one, right?
It was.
Switch sides.
Almost started before you
Yeah.
got all the way into it.
Yeah, we say that releases on setup. Like just as you're setting up, it's already releasing. And then scoot towards the edge a little bit. This time it's opposite. You'll bring up the right leg. This one goes straight. And so that was really nice. So we got this low back, this L5 to release. We're going to go up one segment higher to L4. We're just going to do a little one on that. So you drive your shoulders back a little bit. No, it didn't go. There it goes. Do you feel it?
I did.
That was good. So lie on your back now. And that's good. Good. So come stand up and see how you feel. And move around a little bit. Good. I know you had a little bit sitting, so go from sitting to standing. And then stand up. And see if it's looser.
I would sit for a few seconds.
All right.
Because that's when it hurts the most, when I've been sitting for a while.
Yeah, so sit for a minute.
Felt good.
Okay, good.
Barely felt anything.
All right, man.
Thanks, Doug.